Hey y'all, I'm the Vagina Rehab Doctor. My name is Janelle Howell and I am a pelvic physical therapist. I'm a specialist in women's health, or commonly known as pelvic health, and I'm going to be talking to you today about how to build your sexual confidence with vaginismus. If you don't know, vaginismus is a condition that makes it nearly impossible to achieve vaginal insertion. This can mean that you're trying to have sexual intercourse by means of a penis inside of the vagina, or maybe a toy inside of the vagina, or a finger, or a speculum if you go to a pelvic exam and it just cannot get inside. There's like a brick wall. That is the most common symptom that people with vaginismus feel. It feels like you're hitting a brick wall. This can make it extremely difficult to feel fulfilled in your sexual relationships. This can even contribute to infertility, and it places a big distress on one's mental health. There can be thoughts of being worthless in terms of fulfilling your partner's sexual needs. There can be poor self-esteem, and there can just be a lot of impacts on your mental health and your emotional health. I encourage you to reach out to a mental health care provider, get yourself a psychologist, get yourself a mental health, someone on your team to really help you to boost that awareness of your emotional being and how you're responding to this condition. Now, what I want to talk to you though about is how to boost your sexual confidence, because as a pelvic physical therapist working with many women and people who have this condition of vaginismus, it can take a big toll on your confidence overall, but especially on your sexual confidence. And in order to have a fulfilling sex life, and in order to really feel comfortable, with your sexuality, with your body, confidence is an integral part. And so what I want to do is tell you how to boost your confidence in less than a week, your sexual confidence. Because here's the thing, if you are doubting your body, if you are doubting your sexuality, if you are ashamed of your body, if you're ashamed of vaginismus, if you're ashamed of what you're going through, then that is a direct block to your advancement. That's a direct block to you getting better. And I can tell you that it doesn't matter how long you've had vaginismus, that it is curable. Not just treatable, but it is curable. It's curable. And I'm even working with about 5 people right now who have vaginismus, and I'm seeing them make tremendous leaps and bounds in such a short period of time. Many of them have had vaginismus in which it is primary. So there's primary vaginismus and there's secondary vaginismus. And primary vaginismus is when this has been happening since the very first time you try to insert anything into your vagina. So maybe you tried to put in a tampon when you were just 12 years old and you realized that you could not get it in. You may have ignored it, or maybe you thought something was going on. You probably didn't do much about it, right? Because not a lot of awareness out here about vaginismus. Secondary vaginismus is when you're able to have penetrative intercourse or to insert things into the vagina, and then all of a sudden you can no longer get anything inside of the vagina. That's secondary. Many of my patients or my clients have primary vaginismus, meaning they've been unable to insert things into the vagina, for example, their finger, for several years, even decades. After working with them for just 4 to 5 weeks, they're now able to insert not just one finger, but 2 fingers into their vaginal canal without experiencing pain. This is a huge leap and bound that you can make as well, especially if you follow these strategies on how to increase your sexual confidence. Because remember, with someone who has vaginismus or even vulvodynia, which is pain along the outside part of the vulva, right? So pain along these regions here, maybe the inner labia, maybe the introitus, which is right here, sometimes the clitoris itself, that's vulvodynia, okay? Vestibulodynia also falls under the umbrella of vulvodynia. Both of the conditions, vulvodynia and vaginismus, are going to increase mental distress. So anxiety, depression is usually associated with some of these conditions. And we don't really know for sure if the anxiety and the depression comes first, or if the vaginismus and the vulvodynia is leading to more of those mental health challenges, but it's probably a little bit of both. It probably is a two-way street going on. And so addressing the confidence is addressing a big part of who you are. So number one, the biggest way to increase your sexual confidence with this is to release any sense of shame about this condition. If you're feeling like you're ostracized, if you're feeling embarrassed about this condition, if you're feeling like you're not good enough because you have this condition, if you feel like you're broken, then these are all feelings of shame that's going to keep your mind in a barricaded state. And once you release yourself from those thoughts, you're not broken. Your vagina is actually not very different at all. Your vagina is not very different at all. Let me just tell you this, that there was research done to look at people who had vaginismus, women who had vulvodynia, and women who had no pain with sex at all. And what they found was that there was no vaginal spasm that differed between someone with vulvodynia and someone with vaginismus. And so we honestly should not even be using this diagnostic criteria of vaginal spasm, like your muscle completely just closes off. What we're finding is that there's no huge difference between someone with vulvodynia and vaginismus. The biggest difference was that there was way more tone, meaning more tightness, more tension in the pelvic floor of someone with vaginismus. And there was disassociative behavior. There was fear of pain with someone with vaginismus. Those are the biggest differences. And so this can help us to understand that, wow, my vagina is not that different. If I have vaginismus, let me release that shame that lets me think and has me thinking that my vagina is somehow less than everyone else's. Your vagina is not too tight. Your vagina is not going to restrict you from having sex. It's none of that. It's more so about how our brain is processing insertion and how that is contributing to the pelvic floor tensing. And so number one, this is what you're going to do. You're going to release the shame. You're going to say, you know what? My vagina is actually not that different. Yeah, it's a little bit more tense. There's a lot of people out here with a tense vagina that are having sex. So we're not going to let that be a barrier to you feeling like you can move on despite this diagnosis. The diagnosis of vaginismus is curable, meaning you do not have to associate yourself with vaginismus for your whole life. The purpose is to get over it, move on. And it's not always immediate, or it doesn't happen in a short period of time many times, but it happens. And I'm seeing quick improvement with my clients. All right. And so now what we want to do after we release that shame is we want to master neuromuscular control. Master neuromuscular control over our vaginal muscles when anything is coming inside. Whether that's a toothpick, oh, that might hurt. Whether that's a Q-tip, so something like this. Whether that's a really small dilator, or whether that's your finger. These are all three objects that are going to be monumental to helping you overcome vaginismus. Okay? So what I mean by neuromuscular control is that when you are inserting the Q-tip into the vaginal canal, what you're going to do is first you're going to squeeze once before you even put anything inside, and then let go completely. When you let go completely, let that be your open sensation. Let that be your bloom sensation. And you want to register what that feels like in your brain, because that is what you're going to try to continue to feel when you're inserting the Q-tip into the vagina. Okay? So again, squeeze your anus and your vagina all the way, and then completely let go, all the way, completely. That all the way release, dropped and open sensation is what you want to try and maintain as you're inserting. You do have some control over your pelvic floor. And I think that it's harmful when we tell people with vaginismus that they have absolutely no control. Of course, there are muscle contractions that happen. There can be pain that's felt. There can be tension that's felt. But you do have some level of control. Even relaxing your belly, like letting your belly relax completely out, bulging your belly out, Don't hold it in, suck it in. Relax your butt cheeks as well. Let all of that go. And try to keep those muscles fully open as you're inserting the Q-tip into the canal. And if you feel yourself clench, stop, relax, and then you can try again. So number 2 is practice that neuromuscular control. You can even practice doing this in sitting. In sitting, squeeze your anus in your vagina, lift the pelvic floor, not your butt cheeks, not your belly, but your anus and your vagina. Squeeze and lift that muscle up, and then drop and open down below. That dropped open sensation is what you're going to try and maintain when you're inserting something inside of the vaginal canal. It doesn't matter how small the item is, okay? And then once you do that, once you get that neuromuscular control in terms of the lengthening, the dropping sensation of the vagina and the pelvic floor, the next thing that you want to do is you want to get comfortable touching your vulva like this, and also inserting even just one finger into the vaginal canal. Baby, you're gonna have to become best friends with your vagina. I'm talking about, if you got 5 minutes free, I'm about to go use those 2 minutes to insert my finger. It's therapeutic. It's therapeutic. The vagina is made for insertion and excretion of objects. Excretion of blood, excretion of vaginal discharge, excretion of cervical mucus, excretion of babies, and then also the insertion of penises, toys, speculums, clean fingers, and that sort of thing. So, number 1, release the shame. There is no shame in vaginismus, as there is no shame with having a cold. Like if you get a cold and you're sick and you got COVID, there's no shame in that. It's a process that happens to the respiratory tract. Vaginismus, this is a condition affecting millions of people worldwide. There is no shame. You are not broken. Your vagina is not fragile. Your vagina is not too small. The biggest thing that you can do for yourself is release that shame and say, you know what? I'm good and I'm going to get past this because this is curable. Embracing that confidence is the best thing that you can do for yourself. Then number 2, take that confidence with you to now embrace neuromuscular control. What this means is that you're going to be able to now assess when you are clenching and when you are letting go. If you can just feel that difference, squeeze all the way and then completely relax and let go. That's called neuromuscular control. If you can say, now I want to relax and let go, and you can feel that drop down. Now I want to squeeze, and you can squeeze the anus and lift that pelvic floor, and you can feel that. That is your brain telling your muscles what to do. That is neuromuscular control, and that's so necessary for a normal sex life, for overcoming vaginismus as well. Okay, so whenever you're inserting anything into the vaginal canal, dilator, Q-tip, finger, penis, you want to first, before insertion, squeeze 1 time all the way, tighten the anus and the vagina, then drop and open the pelvic floor like you want to fart or pass gas. Let it go, and then can you maintain that dropped, that open sensation with insertion of any product? Number 3, you're going to use your free time to insert things into the canal, the vaginal canal, excuse me. So when you have free time, think, oh my gosh, I can go spend time with my vagina. That's what you want to do, because the more your brain stores those experiences of successful and safe insertion, the closer you get to kicking vaginismus goodbye. It's time for vaginismus to go, baby. It's enough time. You've had this for long enough, okay? It's time for it to go. All right, number 3 is that you're going to spend time inserting things into the vagina and practicing that neuromuscular control and that confidence at the same time. Even if it's just this. Can you do this without clenching up? Can you relax as much as you're able to? Can you relax the belly and the butt cheeks? Can you let go of your anus while something is going inside? Can you keep your anus relaxed? Can you keep your vagina as quiet as possible? These are all steps to helping you to overcome vaginismus. I'm a pelvic physical therapist. I've been treating people with vaginismus for years. I've seen people overcome it in a few months. And I know that you can be that person too. Reach out to me if you have any questions by visiting my website, vaginarehabdoctor.com. I do have a Vaginismus to Vagilicious self-guided e-workbook that can help you to overcome this condition on your own from the comfort of your own home, and it works. You can also download my Vagina CEO Release e-guide if you're interested in pelvic floor exercises to further teach you how to relax your pelvic floor and open up those muscles to promote healthy sexuality and to allow you to overcome vaginismus. And then lastly, if you would like to contact me, you can send me an email at vaginarehabdoctor@gmail.com. Okay, vaginarehabdoctor@gmail.com. Vagina Rehab Doctor is also my social name on all social media platforms, TikTok and Instagram. You can find me on there at Vagina Rehab Doctor. If you've enjoyed this video, please like and subscribe and share this with someone you know, or leave me a comment below. Thanks for watching, you guys, and I'll see you next time.